Greetings and welcome to the COVID-19 1 year later, dealing with stress and depression, hosted by the St. Mary's County chapter of the NAACP 7025. My name is TJ Hudson. It's my esteemed pleasure to welcome each and every one of you here tonight. Additional heads up, in wake of the surge in the gun violence in our county, there will be a forum where the Sheriff Cameron and Commissioner Morgan will be in attendance. Those dates are yet to be determined, but please be on the lookout. So check your media platforms, the 7025 website, and other areas for that information of those upcoming very important events. So without any further ado, I turn the evening's event over to Ms. Sharika Butler.
Okay. Good evening. All right. Good evening. My name is Sarika Butler, CMA. I have the pleasure of introducing our guest speakers this evening, Sarah Woodard, licensed clinical social worker, and Dr. Tamara Davis. Ms. Woodard has been in practice for over 23 years. She's the president of S.G. Woodard Psychotherapy, LLC. She has worked with mental health patients in the acute and outpatient mental health settings. She has specialized in caring for adolescent and pediatric population and uses cognitive behavior therapy and specializing in helping people recover from traumatic events. Dr. Tamara Davis is a board certified psychiatrist who has served inpatient, outpatient, and most recently telepsychiatry settings. She attended Xavier University, where she obtained her bachelor's located in Louisiana. Bachelor's of Science, I'm sorry. She obtained her medical degree from the University of Tennessee Health Science Center of Memphis, Tennessee, completed her residency training in adult psychiatry at St. Elizabeth's Hospital, located in Washington, D.C. Dr. Davis developed an interest in cultural competence as a tool for more effective therapeutic engagement during her residency program. She was drawn to the community mental health as a means of assisting patients along their path to healing and prides herself in planting the seeds of self-care and overall wellness. Dr. Davis is the Chief Medical Officer of the Telehealth 24/7 and also provides medication management for inmates of Maryland detention centers. She is passionate about minorities' mental health and bridging the gap between the underserved, underrepresented demographic within the larger social edifice. Thank you.
Thank you, Sarika.
Thank
You're
you so much.
Welcome.
So I'm Sarah, as you might see from my name, and I'm going to start things off and then hand it over to Dr. Davis. We're going to both be toggling back and forth with giving you some what we hope is really helpful information in navigating these waters 1 year later with what can be called a double pandemic. So what our objectives are for tonight include talking about the current state of mental health in the Black community, talking about pathways to mental health treatment, some common experiences that you can be aware of, and the how, when, who, what, wheres of mental health treatment. Talking about barriers, not just the logistical barriers, but emotional barriers to seeking treatment. And we'll provide you some local and national mental health resources and really just raising awareness. So I want to just pause for a minute with you looking at the slide to the right that says you are not alone. I think this is really powerful for us to all think about. Only 1 in 3 Black Americans who need mental health care receives it. So really, just sit with that and think about that for a moment. And how many people are on the struggle bus, basically, and not getting the support and the help they need to heal. So we hope to help give you something to take away from today. Dr. Davis, I know you're on the next slide there.
Yes, so we're going to move to the next slide. Thank you so much for that introduction, Sarika. And we're going to dive into the crux of what we want to give a background for tonight, and that is Black communities and mental health. These are some statistics that are pretty stark, and it's important for you to recognize that we are not addressing our needs as far as mental health care is concerned in the Black community. So compared to whites, Black patients are less likely to receive guideline consistent care. And by saying that, I mean basically standard of care, standard of what everyone should be receiving. And another important stat or important fact is that compared to whites, Black patients are less frequently included in research. And that is something that many of you have heard even recently when we're talking about the COVID-19 vaccination, and folks not having or having vaccine hesitancy, particularly in our community, despite the fact that we were disproportionately affected. Both of those things, both of those facts were made plain on the news, and yet this vaccine hesitancy harkens back many, many years due to the misuse and abuse that the Black community has received when it comes to healthcare in general. Thirdly, whites, compared to whites, Black patients are more likely to use the ER or their primary care physician rather than mental health specialists. So instead of getting the care that you need by a therapist and not being in a crisis, in the Black community, we're more likely to be in crisis and go to the emergency room, or to try to mention it to our primary care doctor in secret instead of making it something that is normalized. You can see on the right-hand side of the screen that the numbers are there. Based on information on this screen, you are talking about 13.4% of the population being African Americans, which equates to about 7 million people when you think about the fact that 16% of our community is reporting issues with mental health. So that's 7 million people, and out of that, only 1 in 3. So those are the numbers that we're looking at. We can move to the next slide. So as we talk about this, it's important to focus on our youth as well. The mental health in the Black community has been particularly impactful on the well-being of our youth. What I see often is that Black youths are ending up not only having the prison to pipeline where they are ending up in jail in higher numbers, our Black youth higher numbers than white youth, but also when there's mental health mixed in there, when there's mental issues such as ADHD or bipolar disorder, then you've got even higher levels of incarceration, and these children are not getting the help they need because now they're incarcerated instead of getting mental health treatment. Another impact on our youth is that you see a lot of misdiagnosis, and this has been going on for years. Patients that probably could have gotten a diagnosis of ADHD and been managed properly with either therapy or medication and therapy, and yet they never got evaluated or treated for many different reasons, distrust of the community, and we'll talk about a little bit about that later, but also just not having that access to being evaluated. And so those children, again, being misdiagnosed and not meeting their potential or falling prey to the judicial system. And lastly, on this slide, I have pointed out that less access to services is another impact on our youth. That is across the board, but particularly with our youth, there are low numbers of child and adolescent mental health specialists. And so that parses out to even less for our community to have access to. what I want you to do now is, now that you have the mental health facts for what I would consider our community, then the next thing that we need to talk about is the undeniable impact of COVID-19. I don't have to tell you, because you've heard many, many times, that we were affected much more than our white counterparts. In fact, in the US, Blacks were 3 times more likely than whites to contract COVID-19, 5 times more likely to be hospitalized due to COVID-19, and 2 times more likely than whites to die from complications of COVID-19. And many in the audience likely know someone that is either in their family or someone that is a friend who did fall prey to COVID-19 and is no longer with us. These are some graphs that depict those impacts. And you can see here, I even included one for Maryland so that you can see the racial distribution of the COVID-19 cases in Maryland. And now we kind of circle back to COVID-19 and the impact on mental health, and particularly as it applies to race and ethnicity. And so below in the bottom of this graph, you can see that there are several different diagnoses of anxiety and depression and other mental health symptoms. And the numbers that affect our community are significantly higher in almost all of the different diagnoses. Yet again, when you harken back to what we talked about earlier, that we're not getting the access, that's very troublesome. Access to treatment, that's troublesome. Okay, so here's some information from, according to the American Psychiatric Association, there are African Americans are experiencing trauma and mental health issues for many different reasons during the COVID-19 pandemic. And those are listed as anxiety. Anxiety covers a lot of bases, physical symptoms, as well as mental symptoms, as well as issues with functioning. And that is something that was experienced due to not being able to stay at home because you were the primary breadwinner, or you had a job that required you to go in and you were not part of these droves of folks that were able to stay home and complain about being at home. That had more impact in our communities because we, as a community, have more frontline workers, and those numbers were affected and likely caused a lot of anxiety for that group of people. Other ways that trauma was experienced by Black Americans would be separation from their friends and family, as well as grief over the loss of friends and family members. There was a lot of emotional stress due to the fact that even though we're told to socially distance, you have a house full of people that may just need to go to work. Maybe you have first generation, second generation in your home, particularly Brown and Black communities that had no choice but to live in close quarters, and also have to, if they didn't live in close quarters, now had to find childcare, which is particularly difficult. And I know for myself that despite my privilege of being employed and able to work from home, just being able to secure childcare for my children while I'm working from home, those were all very traumatic events that COVID-19, the pandemic, created. Lastly, financial strain was something that was experienced due to job loss, due to all kinds of things that came up with healthcare costs, and ongoing difficulties with access, which you'll hear us say throughout this presentation. Access is so important, yet in our community, we are not getting the access. And then this just compounded things for the Black community being able to have access to the services they needed. Maybe, yes, you can see your doctor through telemedicine, but you didn't have internet service because now you have some financial difficulties. So all of those were different ways that we were impacted as a community. So this is a slide that, of course, has faces of folks that we are very familiar with, because as we were trying to keep up with what was going on with COVID-19 on the television, if we had the privilege of staying at home, then these were the faces that we saw throughout that time. names of folks such as George Floyd, who we know was murdered by the police. And we watched that video over and over again. And of course, we talk about saying their names, making sure that these folks are not forgotten. But this was what I would consider racial trauma, which was the cumulative effect of racism on someone's mental and physical health. And yet, not only was this racial trauma, but what I'm considering extended trauma, because each and every day it was another face, another death, another murder, another violent act that was seen and witnessed in what has been coined as viral Black death. This is viral Black death of watching the same scenes over and over again, which added to the trauma in the Black community that already had numbers of 16% or more likely to report mental health problems in the general population. So you can only imagine that if it was already 16%, and now with the extended trauma of witnessing the United States perpetuation of racism, and that is something that we definitely experience as trauma. So that's where we talk about the double pandemic.
Thanks, Dr. Davis. And I'm going to start with the next slide. Just taking a look at all these faces. How many of them are you surprised to see? Actually, the people in this slide that also struggle with mental health issues. That's just to highlight some of the many people that are struggling as well. So we've talked about the conditions in the last over a year, really, between the pandemic of COVID and what that's brought about, the experiences that has brought about for many people, but also the racial trauma on top of that. So many different circumstances that have been so stressful for so many. I'm going to talk a little bit about what are some common reactions that people are having, but also what are the red flag signs to look out for to know maybe I need to do something about this. So first and foremost, what we want to look at are changes from your usual level of functioning or someone that you love. And this is not just 1 day, 2 days, but really, a persistent period of time where a number of things are happening at the same time. I'm sure all of us can say, at least during some period of time in the last over a year since the pandemic started, that we struggled with one or several of these symptoms, whether it's a few days, a few weeks. So one symptom being a change in appetite. So that could mean eating a lot. It could mean losing your appetite, weight gain, weight loss. A lot of people jokingly talk about, maybe half jokingly talk about the COVID-15 or COVID-20. But, when we're stressed, we look for comfort or have a hard time doing things that we normally do. Change in sleep, sleeping a lot more, having trouble falling asleep, waking up really early in the morning. For me, I know, at least for the first few months, I did have periodic times, especially in the beginning, of what we call disrupted sleep, where maybe your mind is racing and you're waking up multiple times because you're thinking about all these things you have to tackle or that are worries and weighing you down. Less attention to basic hygiene. That could be going for a week without showering, not brushing teeth. Loss of motivation or interest in things that you're normally interested in doing, whether it's cooking a meal for your family, tasks at work, having a really difficult time just getting through the normal course of the day. Loss of energy. Stress really exhausts people. And you hear that a lot. When people are anxious, when people are stressed out, they're tired and they may need to sleep a lot more. Loss of concentration. So for me, clearly I'm privileged by virtue of being white. I don't have that baseline of racial trauma, but when I saw George Floyd's death on TV repeatedly, it was so horrific to me that it was like my heart dropped in my stomach. And for several days, I mean, I was not present in my life. I was so preoccupied with reacting to that and thinking about that image and what he went through, what the family went through, that, you know, I was clearly distracted. I may have, you know, put up a fairly good front, but this is what I was experiencing. So imagine with the racial trauma and everything else going on, how much more compounded that is for someone. In addition to that, low mood, frequent crying, irritability. What we might see more is in men, the tendency to show anxiety or sadness with more irritability, because of course that's considered socially more acceptable to show that part of you. And you see that more in kids and adolescents too. You might tend to see more of that, and not necessarily just someone crying all day. Excessive fears related to getting sick, not just what we've all been doing, which is wearing masks, sanitizing when we touch doorknobs and things like that, but you might see more of refusing to leave the house, washing hands for 20 minutes at a time, getting raw hands. You could see that with like red or pink skin from washing, sanitizing over and over and over again, repeatedly needing reassurance, repeatedly researching. So that's another sign that's a red flag. Of course, the increase or start of drug and alcohol abuse. Suicidal thoughts, which we can call, you know, on the more mild end, might be more what we call passive or fleeting thoughts, like I just don't want to be here anymore, I just don't want to wake up, all the way to I want to die, I want to kill myself, and I'm going to drive my car off of the bridge. And we can get into that a little bit more later when we're talking about getting help and how does that look. Self-harm doesn't necessarily mean someone's suicidal, but yet again, it's a red flag, whether it's cutting, burning, scratching. And with kids, I work a lot with kids. So what you would see as red flags and want to be concerned for and look out for is what we call regression. So what that means is reverting to a previous kind of period of development. So for instance, you might see a kid start to suck their thumb again. They might have gotten over that, but start to suck their thumb again. Bedwetting, more clingy, crying more, tantrums. So you might see a lot more of those kinds of behaviors in kids, and the irritability, like I talked about.
Yeah, this is a great list. And I mean, I can check many of those things off that I experienced in different levels throughout these last 18 months. And so I think that this is very relevant, and surely there are a few that the folks in the audience could check off as well.
So we've talked about the impact the environment has had and the situations that we've been through have had on us, what some of the symptoms are to look out for, and that many of us have gone through. But we want to also talk about, okay, what do you do next? What then? Like, how do I deal with this? One is practical ways, and I'll go in a couple slides into more of the more formal ways to get help. So practical ways to help yourself or a loved one. One, this is actually one that I learned way back after 9/11 in a conference that someone presented talking about community trauma and disaster. And one of the things that you can do is really remind yourself of the hard times you've been through before. We've been through hard times before. You have 100% survival rate. What helped you those other hard times? Really pulling from resources that have helped you before. And many of these things on the list could be the answer. So faith community, if you have religious beliefs, lean on your faith community. Talk to your pastor. Go to church. Go, if you can go in person, maybe that's going to give you more of that sense of connection and support. Talking with other parishioners as well. Prayer. I know people who use the Bible app and love that as well. And I'll go into apps too. Relationship support. So, I mean, that's probably a common sense answer, but really want to think about reaching out to people. Often, many of us have this idea that I need to somehow push through it. I got to be stronger and just, buck up and get through this. But that's what our loved ones want. They want us to, if they truly care about us, they want us to lean on them during those hard times. And that's, two-way street too. If we can show our vulnerability to people that we love, then they'll feel comfortable leaning into our support too. If as long as it's a safe space for us where we feel heard and understood. Self-help apps like I love calm.com. There's Breathe to Relax. So they help you with managing the signs in your body of stress, books and videos. And I know Dr. Davis is going to go through some of her favorites too toward the end. But I also have loved watching Red Table Talks. I don't know if anyone's familiar with that show, Red Table Talk, with Jada Pinkett Smith, Will Smith. The Estefans also have a more recent series, and this is through Facebook. It's a show. And they brought on professionals in the mental health field. They've really done a lot of work fighting against the stigma of mental health, substance abuse. And they've talked a lot about the effect of racism as well, trying to heal a lot of wounds. I love that show, so I highly recommend it to anyone. Exercise. When we have stress and trauma, anxiety, we need to get the body moving. So whether it's walking, whatever it is, stretching, whatever you can do, that can be really helpful. Yoga as well, meditation. There can be mixed ideas about, okay, meditation. Well, I'm sitting there quiet. And a lot of us in a faster paced society have a hard time sitting still. But actually research has shown that it can change the brain and help you manage that anxiety. Sleep. 7 to 8 hours of sleep where you can. Obviously, you want to do what's within reason that is possible and reasonable for you. And I'm actually a big napper, so power naps, great. I love them. 10 minutes, 20 minutes. I wouldn't recommend more than 20 minutes because it can throw you off with your natural sleep rhythm. Healthy eating. And if you are limited in finances and resources, buy in bulk. Frozen vegetables are just fine. Where you can. And I use apps. I use MyFitnessPal to help me manage, okay, am I eating enough of this and that? So MyFitnessPal, MyPlate.gov are good apps for that. Alternative treatments are also great. For instance, lavender oil, research has shown that's really effective in helping to induce sleep and help people relax as well when they're feeling stressed out. Acupuncture, massage, also alternative treatments that you can consider. And really also something that doesn't have to cost money is just planning for fun. Have something to look forward to. Get your family planning a hike. Next weekend we're going to go to Calvert Cliffs. It doesn't cost money. Bag a lunch. Eat snacks along the way. Get out in nature. Actually, studies have shown that hiking for 90 minutes reduces the anxiety and the negative thoughts. So just to kind of put that out there. And I'm ready for the next. There we go. So we talked about practical ways to get help or to help yourself, actually. And now we're going to talk a little bit about how to seek professional help for you or a loved one. So we're going to talk a little bit about, okay, when do we take the steps? What are those steps? And what to expect with getting professional help. First, there are a lot of misconceptions out there about what a psychiatrist versus psychologist versus a social worker versus a counselor, who are they? What's the difference? What do they do? Who does the meds? So first and foremost, as you can see, Dr. Davis is a psychiatrist. So psychiatrists have to have a background in at their baseline of medical training. So they have a medical degree. And then on top of that, they get additional training and education in psychiatry, understanding biology, and they are able to prescribe meds. So if you go to see a psychiatrist, it doesn't necessarily mean you're automatically going to get medications. But that's a good place to talk to a psychiatrist and get a consultation. Like, here are my symptoms, here's what I'm going through. And they might or might not suggest medications, and you can take it or leave it, just to kind of put that out there. And Dr. Davis, I'm sure, can add to that if she has anything else. So we have psychiatrists who prescribe the medications. Some of them do therapy as well, but a lot of them down in Southern Maryland, you're going to see a lot more of the short visits where it's more problem focused. And, I hear a lot of people talk about 15, 20 minutes, 30 minutes seeing a psychiatrist. That's not unusual. It doesn't mean you're being gypped in some way. And then there are therapists. Under the general umbrella of therapists, there are psychologists, social workers. I'm a clinical social worker, counselors, licensed marriage and family counselors as well, substance abuse. We all have to be able to do one-on-one therapy, group therapy, and so on. Most of us, we have to have a master's level of education, which includes training. And then for psychologists, many of them will get a PhD as well. Psychologists, you'll also see that they can do testing, like psychological testing. For instance, in many schools, if your child needs testing to see if they have any learning disabilities, difficulties with certain subjects, and maybe ADD, ADHD, you would be referred to the psychologist for testing. But psychologists don't have to do testing. They can be in their office in private practice seeing you, and in other settings as well. So again, psychiatrist prescribes medications. Psychologists can do testing and therapy, and a lot of the other people can also do therapy as well. So let's start talking about, okay, when do you need to see a therapist? Like, what do I need to be struggling with? What's too much? What's not enough? Here's a question for you to all think about. What are the reasons to see a therapist? I want you to think about the answer to this. And the next slide will have the answer, but think about this. You're feeling stuck. You're struggling with the loss of a loved one. You're the primary support for people in your life. You feel hopeless and fantasize about not ever waking up again, and all of the above. So let's see what the answer is in the next slide. All of the above. So really, there are so many different reasons that are valid for you to see a therapist. If it's a life situation that's come up, COVID, all the violence and so on, and you're struggling with navigating that, yes, that's enough to see a therapist. If you're having a hard time with boundaries in your family, that's enough to see a therapist, as examples. So if you ever have questions, when in doubt, you can always contact someone, and I'll go into how you can do that, and say, hey, this is what's going on. What do you think? And the therapist or psychiatrist can tell you, oh, this is what I think might be helpful for you. And then you can go from there. So how to get the professional help when you feel like, okay, I need to do something about this, and doing my own stuff isn't enough. I listed these in order. So number one, you want to think about your insurance. Do you have health insurance? If you do, call the 800 number on the back of your card, member number, and ask for what your benefits are, and ask for a list of providers that are in network for you. I would even say like 5, because you might go through several. You can also go online and check on your own. You don't have to call and go through the automated system. You can go online and check your benefits and plug in your zip code and see who gets pulled up. If you don't have insurance, number two, you can also self-pay, and you don't need to have tons of money. There are options. So a lot of therapists can do a reduced fee, or what we call sliding fee scale. And there are certain clinics that can do that as well. I know in Southern Maryland, in St. Mary's, Pathways is one of them. And I personally do offer sliding scale fees according to your circumstances. So you don't have to have hundreds of dollars. And you can use a search tool. In addition, you can cross-reference that too. Like you get a list from your insurance company, and then you can go on Psychology Today and see who within your zip code might provide the type of therapy you might be looking for. You just search a condition. It could be anxiety. You can look over their description to see what they help with. So that's great for everyone, psychologytoday.com. And through psychologytoday.com, you can email or call the provider with your request. Again, like I mentioned, like, how to know, is this enough to get therapy or is this too much? Email or call them, please. I offer 15-minute free phone consultations. So you can call me up and say, okay, this is what's going on. And I could say, you know what, I think, we can set something up. And please be patient too. I know that's kind of number 6. I kind of skipped over the telehealth, but in the process, please be patient with the process, because you may get people saying, I have a wait list. Don't give up. And you can cross-reference and like call other people too. That's what I always say. If I have a wait list, please, I'll keep you on the wait list, but please feel free to call other people while you're waiting. If you find someone else, you're not obligated. Telehealth is another way to open up doors for finding someone to help you. So many, if not almost all providers since COVID especially, have been providing virtual therapy. And so that is another option. And you can expand outside the county that way. You may not be able to go out of state unless someone has a license to practice outside of their state, but it does open up more options for you. And really, second opinions are okay. You go to see someone and you're like, I really didn't feel comfortable with him or her. Then get a second opinion. And I always say that, like, you're not obligated at the end of the session. That's for you to almost interview the therapist and say, is this someone that I feel comfortable with? Is this someone that I feel is qualified to help me with what's going on? Bottom line, if there is a life or death crisis, we talked about being, if you or someone you love is really seriously contemplating death, and they have intentions and a plan, and they don't think they can wait another minute, hold off on calling the therapist, call 911, go to the ER, because a therapist is not going to help you with those emergencies, especially if it's not someone that you're hooked up with already. So just want to kind of give you all that information, and hopefully it's not too overwhelming.
Okay, I just want to say sorry for the feedback. My computer's fan has decided to come on, but I'm going to talk over it. So now that you've done your due diligence and you've gone down that list that Sarah shared, and you found the right therapist, and that might be after you played Goldilocks and the 3 bears, and you tried one out and that person wasn't quite right, and then you tried somebody else out and you found a good fit. I call it the Goldilocks 3 bears effect, because I share with patients that is what it sometimes will feel like, and it should feel like. You want to make sure you find the right fit. I found an article in the Wall Street Journal many years ago, and I passed it out to patients who are looking for therapy, who happen to end up in my office before they're seeking therapy. And so that kind of goes back to what the scenario is right here. Typically, as a psychiatrist, I have patients that are referred by their therapist to see me. But it definitely could be the other way around. As Sarah very nicely explained, there are different niches for each of the different people that are mental health specialists. But for a psychiatrist who prescribes meds, sometimes that's not indicated. And so really the therapy was the first step, but that person didn't know. And they went on and made an appointment with a psychiatrist, and here we are. So I refer them back to making sure that they're in therapy. But in this scenario, you've done your due diligence, you're sitting in with your therapist, you've had a few sessions, you feel like you're getting a lot off your chest, and like that little picture, which I love, to the right, where things are starting to come together. And then the therapist throws you a screwball. It's like, whoa, what's going on? The therapist says, I think you need to go to see a psychiatrist to talk about medication. So this is an uncomfortable situation for many patients. They don't understand why, if they're getting help from the therapist, why is it that they would need to go and talk about medication? But what I look at it as is an opportunity. If your therapist has shared with you that medication is something that may be in your future, it doesn't mean it has to be, but it means that you need to go and see a psychiatrist so that you can be evaluated to find out if it is indicated. And on the way to doing that, you can also get that second opinion, making sure that your diagnosis is established. A lot of times with paperwork for disability, as well as paperwork for different things such as time off from work due to trouble that's more of short-term disability, that's something that would need to be solidified. And sometimes they want a doctor to document that you have a diagnosis. And so that's a great opportunity to have that done. But let's say that your functioning has been affected and you're functioning at 50%, and the therapy maybe has bumped you up to 60%, but it's not quite enough to get you back to your old self. So that's where the psychiatrist would make a determination as to whether medication is indicated. But that's not the end of the story. At that point, there's opportunity to ask lots of questions. I encourage my patients to ask questions, making sure that we talk about a plan. You notice I said we in a plan, not I in a plan. This is not an opportunity for me to force medications on patients, but for us, the patient and myself, to act as a team to come up with the right strategy for getting that person back to their 100% self. That is what the medication is for. It's not there to change folks in terms of their personalities. I get a lot of that as far as questions. Is it going to make me different? Is it going to cause me to hurt myself? Is it going to do things that now cause permanent issues? And so those are questions that you want to ask as you're being evaluated and as you and the doctor discuss the plan. And if the answers are not such that you like, or if you're not getting that conversation, then that may not be the right doctor for you. But you should feel comfortable with the plan, knowing that there's follow-up so that you and this doctor can continue to work on what the goal is for getting you back to your 100%. There are lots of psychiatrists out there who do have shortened periods of time where they may see patients for med management 15, 20 minutes. But if that's not sufficient, then you should definitely advocate or look for a doctor who could spend a little more time. I find that the first session should definitely be something that is a longer session, because that's the time when they're going to ask all about your medical history, as well as any mental health issues and mental health history, family history. Lots of things need to be covered in that first session. So 45 minutes to an hour, to me, would be an adequate period of time. Now, when you follow up with that doctor, there's not that same level of time that needs to be met. So keep that in mind. But what I definitely want you to get out of this slide is that the end of the story is not medication for everybody. And there are plenty of patients that I will evaluate and send on their way saying, hey, come back if things get worse, but I really want you to work with your therapist. Most situations, I will say that I recommend patients, if they are on medications, then they continue therapy, and therapist and myself work together to help you achieve your goals. So back to really talking about how mental health in the Black community has been impacted. These are numbers. These are statistics that existed pre-COVID. And I think it's really important to take a look at this slide, and just so that you can see what we're facing. And we're going to dive deeper into this in the next few slides. So what are the barriers to treatment in the Black community? This is one of my favorite topics because for many reasons, but mainly because I never thought that I would go into mental health treatment or become a psychiatrist. And so that I largely blame on stigma. Stigma that as a physician, as a young woman who was becoming a physician, psychiatry was not at the top of my list. And once I fell in love with psychiatry and shared with my family, they were not very pleased to hear that. My mother said, and I quote, "Black folks don't go to psychiatrists." And I try to share that story with my patients and my friends and anyone I run into, because that is what I want to make a difference in. And that's why I think it's important that we have this discussion and raise awareness, because why don't we? We are missing an opportunity to have a full circle of treatment for all health issues. Mental health is just as important as any other health issue. And yet, as a community who's been through so much trauma for many, many years, we have decided to remove that from our list of possibilities to get better and heal. So stigma is a big one. There is another huge part of stigma that I definitely want to touch on, and that is the church, stigma in the church. You know, we have, as a community, historically gotten our information and our support at the church. And the church is just now coming on board, and not a lot of, there are still many areas, many churches that are not completely on board with having their patients seek mental health treatment, because, you know, traditionally it was, hey, lay your burdens down here at the church, give it up to God, and God will fix it. I also have been known to say many times is God fixes it the way he wants to fix it. And that may be sending you the message that, hey, you need to go see a therapist. There are medications out there to help you. That is something that is important to stress, because that stigma that I'm talking about is pervasive. And I will say that now that the Black church is starting to change, I think with COVID happening and a lot of pastors not being able to be there like they would like for their parishioners and having their own struggles with this pandemic, the message has had to change. So I'm excited about that. There are other historical issues that create barriers for treatment in the Black community, particularly as it's pertained to mental health, and that's distrust of the healthcare system. I've mentioned about the COVID-19 vaccination and vaccine hesitancy, but you know, there's the Tuskegee syphilis experiment of years ago, and then hearkening back to in mental health treatment, I gave a lecture about this very thing when I was a fourth-year resident, how basically there were diagnoses for slaves who tried to run away. Drapetomania. I don't know if you're aware of that, but that was a diagnosis that the mental health community supported. So this is why there's distrust of the healthcare system. Other barriers that impact health in the Black treatment in the Black community is lack of providers from diverse backgrounds. As my mother said, Black folks don't go to psychiatrists. Well, there are more of us out there, but we need to do better. The numbers of African-American psychiatrists is less than 3% in the United States. And it's about equal in the therapist community. So that's just not enough. And we definitely have to do better. Other factors to consider, Other factors to consider are lack of culturally competent care. Culturally competent care is what everybody should have access to. But that doesn't necessarily mean that you have to see someone who's from your same background. I encourage my patients to advocate for themselves, to ask the questions, not just about where this person went to school or what kind of treatment they provide in terms of if they do CBT or different kinds of types of therapy, but also how comfortable are they treating African Americans if they're of a different race or ethnicity? How much time have they spent on some continuous education to try to understand the different impact that trauma has on the Black community, or any facet that affects our community in a way that would be unique and would be foreign to them unless they took the time to put in and get that education. So cultural competence in your healthcare is something that you are entitled to and you should advocate for. Other ways that you can definitely identify barriers in the Black community are lack of insurance. The numbers are nearly 17% of African Americans in 2004 were deemed to be uninsured, as compared to 11% of white Americans. So this isn't new. Obamacare is here, but we really need to continue to push and fight for having it so that everyone can have health care. And until that is going to be a barrier, particularly for our community. And lastly, what I like to call an information void is really what all of this is for. Clearing up the confusion about what mental health treatment looks like, how to go about getting it. If this is not something that we've traditionally done in our community, then how do you know the steps? How do you make an appointment? Like Sarah was talking about earlier. Mental health literacy is the fancy term for it. And I am very passionate about that as well, because a lot of this is like a foreign language for the masses. And so in the Black community, we need to continue to spread the word on not only, hey, you might want to go talk to this person, but let me help you set up this appointment. And this is kind of how it's done. Next slide.
All right. So I do a lot of cognitive behavior therapy, mostly cognitive behavior therapy in my work. And that is an evidence-based form of therapy, which I'll get into. But I think we both felt it was really important to highlight not just the logistical and informational barriers to seeking treatment and historical barriers, but also, and these are common for many people, the thinking barriers, the emotional barriers that make it really hard and cause that pause when you know that you're struggling and, oh, no. If you see yourself in any of those, it's so common. Weakness. That's one of the common misperceptions, that having a mental health condition or struggling with in some way, shape, or form with mental health means that you're weak. In addition, not only do people feel, and there's a misconception about therapy being not valid, like I'm going to go and talk to someone. What's that going to really do for me? Talking. But also my condition is not valid either. So maybe you're thinking it's more of a character flaw. I'm not strong enough. I'm something damaged in me that I have this, that I can't handle this on my own. And I'm all alone. So common, feeling like you're the only one and no one understands. And so those are really common thoughts to have for anyone. Let's talk about some ways to work through those hesitations and those worries. So first, look at that first quote. This is, I'm not sure if many of you are familiar with Brene Brown, but she actually has her doctorate in social work. She is a researcher. She's written New York Times bestseller books on courage, on shame, and she has a podcast. She's popular with Oprah. She's done some really popular TED Talks on shame, vulnerability, and so on. And I really love this quote: "Shame doesn't like words wrapped around it. The antidote to shame is empathy." So the way you can think about that is, these thoughts: I'm broken, there's something wrong with me, there's something wrong with me for seeking therapy, I'm weak. But really, that's, shame keeps perpetuating the pain for us. And really, the way to heal, and really the courageous way to heal, is empathy. And what that means is finding the people that create that safe space for you to lean into and to tell your stories, give them your vulnerability, and have them reflect back to you that you're okay, that it's okay the way you're feeling, and that you're being understood. So this is something that's really powerful with therapy. And actually, feeling validated and acknowledged by others can actually help us regulate our emotions, believe it or not. Evidence-based therapies, it's not just fluff. What that means is that there have been multiple research studies that have shown the effectiveness of these types of therapies. One that I've talked about is cognitive behavior therapy. Multiple research studies have shown it to be effective with all kinds of anxiety, depression, substance abuse, all kinds of situations, all kinds of conditions. So really, they're scientifically backed. And actually, I do a lot of work with anxiety and OCD, obsessive compulsive disorder, as well. And one of the things that just really stuck with me and still does, and I love to share this with people who come through my door and say, they're just not feeling like there's any hope. I show them brain scans that show the change in the person's brain between having OCD before therapy and their brain after having gone through CBT therapy. It actually changes the brain. So it's just mind-boggling to me, and I love it. And that gives me so much hope and really fires me up in helping people, because I know it helps. Anxiety, feeling like you're the only one. You are not. And you may have seen from those pictures before of a lot of celebrities. Anxiety is the #1 mental health condition in the US. 40 million people per year struggle with anxiety. This is according to the National Alliance on Mental Illness. And since before COVID, the statistics showed the numbers of people who have started struggling with anxiety, depression, suicidality, substance abuse have gone up, especially for people in the Black and Brown communities, of course. Examples of celebrities to really think about who also struggle. Alicia Keys has been open about it. I know we recently lost DMX, and he was public about having bipolar disorder and a substance abuse issue. Jay-Z, among many others. And like I said, I really enjoy the Red Table Talk show, and they've hosted, I know Common was on there. I'm trying to think. There are so many people that have been on the show that have really talked about their own experiences with substance abuse, mental health, and so on, and really been courageous in showing their vulnerability to everyone. So I hope that helps with some of you out there who are looking at this and still have those hesitations, and onto resources. So this list of resources, if it's not already, should be on the website for NAACP in St. Mary's. And so these include crisis hotlines 24 hours a day. You can call them up, local and national. So there's a Maryland Crisis Intervention Hotline. There's a texting hotline, 741-741, also good for teens. National Suicide Prevention Hotline, There's the search engine Psychology Today that I mentioned, and there are also online therapy resources, therapyforblackgirls.com, therapyforblackmen.com, and more. So, and I know the next slide goes into a few more resources. So if you look down under Find a Therapist, I'm not sure how well you can read it in the audience, but blackmentalhealth.com. That's the Black Mental Health Alliance. And under Counseling and Community, for men, COVID-19 counseling, blackmenheal.org. For women, sistafia.com. So, and this also talks about, in the case of emergency, dial 911. And Dr. Davis is going to share some additional resources.
Yes. So as a Black female psychiatrist, I am constantly pouring into myself, making sure that my self-care is on point. And one of the ways I do that is by reading and listening to podcasts. So I wanted to include on this presentation some of the ways that I do that so that you can also benefit from these resources. So Therapy for Black Girls is a podcast that I listen to quite often, but here's some other examples of podcasts. Balanced Black Girl. If you go on to whatever podcast app you listen to and do a search, I'm sure that you'll find plenty more. And that's a great way to pass the time. I like to take a walk and listen to my podcast. Another, next slide. Another thing that I have found just for this presentation, I was kind of looking around for some things and I downloaded this app. It's a wonderful minority mental health app that helps with what we've been talking about, which is raising awareness. It's a great information tool, and I'm still learning a lot about it. But as you see, it should be available for anybody who downloads apps. And so check that one out or look for others. Again, search tools are great. Now, last but not least, I'm a huge reader, and I often will make recommendations to patients about books. Books are my lifeline, and sometimes if you don't quite have enough time in the room with the patient, but you know that there's a book that might touch them, then this is a great way to do that. So one I particularly recommend is Black Pain, which is a great book about our own presentation for depression as a community. And it also has a foreword by Mary J. Blige, which definitely pulled my interest in when I first saw the book. You see Jennifer Lewis here, who's on Blackish, one of my favorite shows. She has been very open about her bipolar disorder, and she's written her own story. And then there's some other books there. And I mean, there are so many books. I couldn't even include them all. I've got like books. And so just take a look and see what's out there that you may want to read, because there are stories that people are willing to tell, which I think humanizes the whole mental health journey for us. Next slide. So as we wrap up, we'll go back one. I think you skipped one. Are we okay? We're probably running over, so maybe skipping our slides, but I'll finish up quickly. So we would be remiss if we did not bring up the who I call the founder of Minority Mental Health Month, National Minority Mental Health Awareness Month, and that is July actually. But this is a picture of that woman. She is B.B. Moore Campbell. She's an author who was able to write a story about her own daughter's struggles with the mental health system and just being able to get help for her daughter, which so many people struggle with. And she was able to eloquently put it in her book. She's got many great books, and this one is called 72-Hour Hold that I'm talking about. But it's a great book to just get a sense for what kind of barriers she faced. But because of that, she advocated for more awareness and was able to have this July named as National Minority Mental Health Awareness Month. And now it's actually called Black and Indigenous People of Color Mental Health Awareness Month. So you can skip to the next slide. So I just wanted to mention that because it's important that as we go into July, keep that in mind for yourself and for family to do a better job of taking care of yourself, raising awareness, July or any month. But since we're looking at that being BIPOC Mental Health Awareness Month, then why not? Click to the next slide. And this is just something we wanted to leave you with, that was ways that you can, on your own, celebrate next month. These are some great ideas if you want to read through those and decide that you're going to move forward with spreading awareness and helping yourself with a more holistic approach to your health, because mental illness is a brain disease, and this is something that is involving your whole body, your health, holistic health, and making sure that the brain is expected to be as healthy as the rest of your body. Next slide. Okay, so rush through that last part. Sorry about that. But just remember, it takes all of us talking about it, sharing your stories, normalizing the mental health wellness, normalizing it. And now it's time for questions.
Okay, so we actually ran over time, so we're not going to be able to do the question and answer. So if you do have any questions that you would like answered, please just post them in the chat, and we'll follow up and get to them at a later time. So I would just like to thank everyone for coming out this evening and joining us, and thank Dr. Davis and Sarah for spending time with us and helping us navigate through getting back to normalized living after COVID-19. It's important that they highlighted that Blacks are 5 times more likely to contract COVID-19 and 2 times more likely to die from COVID-19. So it's something that highly impacts the Black community, and the mental health trauma that we've experienced is significant. That, in conjunction with viral Black death, it gave us a double impact, double pandemic. So since our needs are compounded at this period, we thought this forum was an important approach so people can get the resources that they need in the community. It's important to remember that we've been through rough times before, that you've been through rough times before, but you have a 100% survival rate. I thought that was a key statement that Sarah made, and that's something that you should carry on with you. So please remember that if you are struggling right now with any mental health needs, please go and seek help from any of the resources that were listed above. And again, those resources will be posted on our Facebook and website pages. And again, if you're having just questions that you want answered, please just post them and we'll get back to them later on. But I would like, again, thank everyone for their time, and hopefully this information has been helpful. Have a good night.
Thank you.
Thank you.